That's what I am working on right now. So, oh, I have to wait until after we go live before I can do
I
so.
think I think I think you should be able to
Okay.
now. On the right corner of your screen.
Okay. Let me see.
All right.
Uh,
All right. We're live. We're live. We're
okay.
live.
Are we live?
Yeah, we're live.
All right. Excellent. Okay.
All right. Hello,
Hopefully my
everyone. You ready? You
yes, yes.
ready?
I just want to make sure everything, my audio and all of that is working. So
All right.
I
So we
think
can hear
so.
you. Good
Perfect.
evening, everyone. This is Dr. Ola Benton. I am the CEO and co-founder of Living Spring Family Medical Center here in the beautiful city of Mansfield, Texas, not too far from Dallas, where we help patients live long and well because we believe the quality of life is just as important as the quantity of life. If you are watching live, hashtag live. If you're watching replay, hashtag replay. As always, I am delighted to have our guests. I'll have a guest on with us because today we're talking about how to overcome addiction and nurture mental health. We'll be talking with Dr. Bunmi Asana. Yay!
Yay.
Doc, how are you doing? Thank you for coming to the show.
Absolutely. Thank you so much for having me. I'm excited to be here and have this discussion with you today. It's so important. And, I enjoy your videos. I've watched a few of them, very educational. And I'm excited to, share this information with our audience today.
Awesome, awesome, awesome. So now, for those who are watching, could you kindly introduce yourself, Doc? Who are you and what do you do? And we'll go from there.
Absolutely, absolutely. So I'm Dr. Bunmi Asana. I'm a double board certified general and addiction psychiatrist. I'm also a women's mental health specialist. I'm the founder and medical director of Center for Mental Wealth in Houston, Texas. We also serve both Texas and New York as well, where we help individuals who may be feeling stressed, overwhelmed, or hindered by mental health struggles or addiction to build mental wealth, to live a life of purpose, and just have the resilience to handle whatever life throws at them.
Bam. That's a whole lot, Doc. That's a whole lot. And you're in Houston. We're in Texas.
That's
Woo,
right.
that's good. That's very,
Yes.
very good. I didn't know that. That's good.
Yes, yes, yes. We're not too far from each other.
Yes. All right. Now, Doc, why do you do but before I go ahead, people, please, if you have questions, we're going to take them live. So please comment in the section. I'll be able to answer questions or ask Dr. Bumi questions like, but Doc, why do you do what you do?
Absolutely. This is something that's very important to me, and I know, from my personal story, I'm an immigrant. I came from Nigeria, and when I first arrived to the U.S., it was a really, really big culture shock for me. And in the middle of that transition, I felt so isolated. I felt misunderstood, right? I was preteen in that awkward age range and all of that. And it was just something that I feel like it aligns a lot with people who are struggling with mental health issues, because it's not physical, right? You can't really see what's going on. If you have a fracture, right, you see a broken,
Right.
bone. If
Right.
you have, there are other illnesses that are very visual, and people are more accepting of it. And so it's very important that we are able to connect with people who don't really feel like they're seen. And as a result, they don't feel like they're understood or isolated. And I just felt like it was my calling to be able to explore this and connect with people on a deeper level. And I think it's something that I was called to do, right? It's one of those things when I got into psychiatry and learning about mental health, something just clicked for me. Like, this is my passion. I was meant to do this. I felt like I could understand people and connect with them on a deeper level, and just be able to understand their struggles even more than they are able to verbalize it to me. So it's very personal for me, and I know that it's something that I'm able to help a lot of people, and so that's why I do it.
Or it's obvious your passion. Your passion shows in how you
Yeah.
communicate as well. So good. I'm glad we're having this
Thank you.
conversation. All right, so let's delve into it. We're talking about addiction, and we've seen some of the challenges that can come with some different types of addiction. But let's start with misconceptions about addiction, what it is, what it's not. What would you say to that, Doc?
There are a lot of misconceptions about addiction. I would say probably the most popular one is people think that addiction is just a lack of willpower, right? The people who are suffering from addiction, they just don't want to stop, or they're not strong enough to stop, right? And oh well, if it's destroying your life, just stop, right? Maybe they're lazy, or they just want the easy path. And that is so far from the truth. So far from the truth. Addiction is much more complex than that, right? It's something that is it's influenced by a number of things, including your mental health, including your environment, including your genetics, including how you're brought up, your brain chemistry. There are a lot of things that are a factor in this that make it a challenge for people who are suffering from addiction. So part of the educational piece is to help people understand that addiction is not just about people having lack of willpower or being lazy. Their brains are fundamentally changed by the addiction, and so it's not going to respond in the same way that someone without an addiction would respond.
Okay. Okay. Now, is there hope for those struggling with addictions?
Absolutely, absolutely. There is hope. And like I said, the first step is to understand what it is and understand what it's not. And when you do that, then you're able to proceed with the next step. There's absolutely hope. So addiction is something, it's a lifelong journey, right? So it's not something that people are like, oh, this was a time in my life, I've overcome it, it's behind me, I'll never have to deal with this again. Absolutely not. It is a lifelong journey. So you are constantly making sure that you are investing in yourself. You are being aware of your triggers. You are reducing the risk of you going back into those behaviors or that substance, whatever the addiction is about. So there's absolutely hope. People can turn their lives around. People can get on a better path. People can achieve their goals, but they just need to educate themselves and get help, right? And not try to do this on their own.
Thank you. Now, can you kind of list in your experience what are the most common addictions you tend to see?
That's a very good question. And and I love that you asked that question, because a lot of times there are different kinds of addiction that have their 15 minutes of fame, right? They become really popular. They're in the news, and people talk about them. There's media about them and all of that. But the ones that are most common are not always the ones in the news, right?
Mm.
At the end of the day, alcohol is still one of the most common addictions. Tobacco, nicotine, right? Cigarettes, good old cigarettes, is
Right.
still one of the most common addictions. And as far as substances, those are very, very common. And I say that because we have, of course, substances like opioids, right? We heard a lot about the opioid epidemic, and
Right.
lots of people losing their lives as a result of it. Unfortunately, there's there's marijuana, right? That seems to be a controversial topic, right? Especially depending on the state you're talking about it in. But we see people struggle with addiction from that as well. I'll make a caveat and say not everyone who's going to drink alcohol is going to have a alcohol addiction. Not everyone's going to who smokes marijuana is going to have a marijuana addiction. But it's important to note that these substances have the ability of turning into addiction.
Okay. Now let's talk about the connection between addiction and mental health. And someone actually asked a very good question, like what are the signs of mental health issues? What are things we can watch out for? My question was going to be the connection between addiction and mental health. Maybe you could tie that also into what to look out for when it comes to mental health issues.
Yeah, yeah. Addiction and mental health, they are very, very linked. I see a lot of people with various addiction issues, and they never come in with, addiction is the only thing that I'm dealing with. There's always an underlying mental health issue. They are highly, highly co-occurring, right? So a lot of times people start off using a substance because they are trying to, treat some kind of depression or anxiety. Alcohol is a very common social lubricant. So some people may have a lot of social anxiety, and when they have a couple of drinks, they're more relaxed. They can socialize, they can have fun, all of that. And oftentimes it starts off very innocently, and then the problem becomes if that substance is the go-to to continue to treat whatever that thing is, and you are continuing to experience that, then you expose yourself more and more and more to that substance. And then that substance takes over. And now the substance starts to, be the one running the show. So a lot of times there is an underlying, mental health struggle, right? That then the substance becomes something that takes over from there. So that is a very, very common link of mental health and addiction as well. And then apart from the sort of self, medication pathway, there's also the pathway that, people who are genetically set up to have mental health issues may also have a higher risk of just having an addiction, right? So, like I said, our brains are all different. Person A can, use alcohol recreationally, and person B can use it in the same amount, right? But then person B develops an addiction and person A doesn't. Why is that, right? Because they're fundamentally different. Their brains are different, their experiences are different, their genetics are different, and things like that. So that's something else to recognize, is that there are some people that are just more prone to it. And you see that in families, right? So some people will see, oh, my dad, suffered from alcoholism, my uncle, all of my dad's side of the family, right, dealt with alcohol or dealt with some kind of addiction or the other. It's very common to see that because it can very much run in families. And that's to say, right, if that's the case for you, then something to be aware of, right? Something to be aware of, the decision you make, or how you, the role that, substances may play in your life.
Okay. Thank you very much for addressing this. Now, for the person who asked about mental health cues, do you have any tips for them? Like, what are mental health signs that, for someone, maybe they're looking to see, okay, what can I do to prevent the risk of addiction in a family member or a loved one? Are there telltale signs for mental health issues that we should be on the lookout for, or start to say, hey, you okay? Should we get you help? If you could point a few of those for a question and asking guest.
Okay. Yeah, no, I love that question because it tells me that that person, wants to look out for their loved ones, wants to
Yes.
make sure that they are able to identify risk factors, right? Things that are
Exactly.
telling us this is an early sign. So yes, people that we're close to, if they're starting to develop an addiction, or they are struggling with a mental health problem, we may start to see behavioral changes. Maybe they are someone who is very social, they're happy-go-lucky, they're always hanging out. If there's a group gathering, they're the first to show up, and then all of a sudden they're isolating, right? They are not responding to the text message, or they're canceling plans last minute, right? So it's just unlike them. That's something to be aware of. If they are in school and they're starting to not show up to their classes,
Mhm.
their grades are dropping, things like that. That's also something to be aware of as well. We see other things like disruption in sleep. They're having trouble being able to fall asleep, right? If your spouse, or your child or your parent, you're seeing that they're not sleeping, or they can be sleeping too much. Sleep sometimes become an escape, right? If I'm
Mhm.
sleeping, I don't have to deal with the world, I don't have to deal with my emotions, so let's just do this instead. So that's something else that we can see as, okay, some kind of change is going on with this person that I have to watch out for. If the person starts to talk about things that are dark, right? You find them just blaming themselves for negative things that happen, right? Oh, it's my fault. Everything is my fault. That could be a really, really strong sign for depression as well. And of course, if they start to talk about not wanting to be alive anymore, wishing that they would just go to sleep and not wake up,
Mhm.
um,
Mhm.
that is a very critical sign that this person needs to get help ASAP, right? They need to see someone, they need to see a professional, because when those thoughts start to come up, that is oftentimes a symptom of depression, and that's something that can be treated, right? But if it's left unchecked, sometimes it just spirals and spirals until the person actually starts to act on those thoughts, and that's something that we want to avoid at all costs.
Thank you. Very powerful clues and cues to help with mental health gauging. So this was very good. I'm glad we had that question, and thank you for asking that.
Yeah.
Now, of
Yes.
course, this is a broad question. So, are there effective strategies for overcoming addiction? For someone who's watching, obviously, you have to schedule an appointment with you and come talk about what to
Mhm.
do. But what are strategies for overcoming addiction?
So the the really important thing to remember with addiction, and there's a quote that I like, and I don't remember who said this quote, but it's a very powerful quote, that the opposite of addiction is not abstinence, it's connection.
Hmm.
Connection. So people, when they are struggling with an addiction, the first thing they want to do is hide it. They want to isolate. They don't want anyone to know what's going on, right? They don't want anyone to know that it's gotten out of control, whatever the thing is. They want to hide it, right? And hiding it leads to shame and guilt and the really negative spiral, right? Depression, anxiety, all of that. And then it just goes downhill from there. Okay. But when you connect, you're open up, you utilize your support system, right? Whether for you it's a loved one that you trust, that you can talk to, it's
Hmm.
your doctor, it's your therapist, it's AA or NA, right? A support group that you can open up and share with, then then that isolation goes away, right? The power that the addiction has starts to dissipate, because now you're opening up and you're realizing that, wait, I'm not alone, right? There are other people that are struggling with this. And wait, there's a way out, right? Because when you're stuck in your head, it can be a very dark place, especially
Hmm.
when you're feeling very out of control. So that would be the first thing that I would recommend is you've got to make a connection. You've got to open up to someone, someone, right, about what you're struggling with,
Mm.
right? Start
Sure.
with someone you trust, a loved one, if it's a health professional, if it's your psychiatrist, if it's a support group. That's the very important thing to do. And then other than that, like I said, connect with a health professional. They can work with you, therapy, medications if needed. There are and a lot of people don't realize this, that there are medication that can add to the tools of helping people overcome addiction, right? There's a lot of research that has gone into, okay, what are the receptors that are activated when someone is struggling with an addiction, and how can we help them
Mm.
on that side to, and of course, medication is not in isolation, right? It's in combination with the other
Yeah.
things that are going on, but it can be really, really helpful of reducing cravings. For example, there's a medication that we use a lot with alcohol, that we use a lot with opioids, that just reduces the craving. So a lot of people who are, they're obsessed about their next drink, like, when can I have my next drink? I'm at work, I'm craving it. It quiets those voices. And now you can distract yourself from that thought and think about something else, right? Or you have that drink, and then it's like, well, that didn't really feel good. I don't really need to take another one. The medication can actually act on your brain and change the way that it receives that substance. So, of course, you wouldn't know this if you didn't get help. So that's another thing. Make sure you talk to a professional, get some help with that as well.
Powerful, powerful. Now, Doc, I have someone who's maybe watching who's like, yeah, easy for you to say, tell somebody, the costs, the shame, the feeling bad that they struggle with this. I had a few patients, who or clients who are like, no, Doc, I've built a life around this, and to shake the foundation of the relationships, if I were to disclose this. Well, we both know that at some point it will be exposed and it could cost more. So for that person who's watching now, who is not quite decided to get help and reach out and connect, what would you say to them?
Um, it can be a very lonely place to be, right? When you're stuck and feeling like you have no way out. Um, there's a lot of thoughts that you can have in that moment that is just not really based in fact, but based in fear, right?
Mm.
And like you said, um, oftentimes, things come out, and knowing that you are at the point where you don't know what to do, it's getting out of control. Oftentimes, it doesn't just get better on its own, right? There has to be a pivot. There has to be a change. And if the person cares about you, they want to see you get better, right? Chances are, if you continue down that path, there's going to be more um, deceit, right? Because we're hiding things. So there's lies that go along with it. There's, money that's spent that people don't know about, right? There's some people lose their jobs and they're afraid to talk about it with their loved one because, oh, what are they going to say? I got fired because this and that and the other. So the point is, the quicker you get help, the quicker you're able to turn things around and get back on track. So don't let fear get in the way of you getting the help that you need, because ultimately that is the most powerful thing of you being able to get back on track. Because chances are they're tired. They don't want to be in that position, right?
Yeah.
They don't want to lie to their loved ones. They don't want to feel out of control. And so I see a lot of people in my office who come in who haven't told their spouse that they're struggling with an addiction, but they come to the doctor first, right? If you're not ready to talk to your spouse, then maybe talk to your doctor first, right? And start getting help that way. And they can help you work through, if you need to go to couples therapy and help you work through things that way. Chances are, if your spouse sees that you are getting help, they're more likely to be open and forgiving and supportive than just continuing to hide it and all of the damage that can come afterwards.
Thank you. This is really good and encouraging, and I'm sure
Yeah,
it's been the same for viewers who are watching. And there's so many different addictions. There's food too, So there's help, and I love how
absolutely.
simply you explain it. There are many factors that come into play when it comes to addiction. So necessarily it's not all your fault. It's not your fault. So there's help. There are options, and now we know. Okay, so awesome. Now, are there for those who are watching who like to Google, who like to say, yeah, is there any online resource I can go to look and contemplate seeing a doctor or seeing someone to help me? Any online resources you recommend, Doc?
Yes, absolutely. The national resource is SAMHSA, and the number is 1-800-662-HELP, to get help for either mental health or addiction issues. They are able to connect you with, someone in your local area, depending on your situation, what you need, and can talk you through it. So that's an important number that I think that people can know. Especially, I know our talk is going to be broadcasted all over the country, so people will maybe in different regions, and so that's a good place to start. Of course, another number to know is 988. That is the helpline, suicide and crisis lifeline, that trained people are on the other side. If you feel like you are in crisis, if you are worried that you may be a danger to yourself or to someone else, or someone who's close to you may need that kind of help, 988 is a crisis line that can connect you with help as soon as possible. And of course, you can always reach out to us at Center for Mental Wealth. We are able to see people across the state of Texas, and also in New York virtually as well. We can help you with various mental health issues, addiction issues, and yeah, we just I think the most important thing is that people reach out and get the help they need.
Yes. You have no idea. I really appreciate what you just did with sharing that information and just confirm it's anonymous, so you can call and not have to say too much.
Yes,
Okay.
absolutely. Yep, absolutely. You can release as much as you want to say, or as little as you want to say. People, they will meet you where you are, because they are trained to help. You're in crisis, they want to help, right? So the fact that you made that effort to call that line, they're like, okay, this person wants help, so they want to help you however way they can. So yes, please reach out, get help, and you'll be glad that you did.
And we're rooting for you. We're giving you virtual high fives, high tens to get
Yes.
fist pumps, whatever
Yes, that's
you know,
right. That's
to
right.
get you going. So please be encouraged. Share this with those who could find this useful. But Doc, for those who are watching, who are like, I like this doctor. She explains addiction in ways I've not heard before. Doc, where can people find you either to have you come speak on their platform, to connect with you, or to get content from you, Doc?
Yeah, absolutely. So I'm on various platforms. You can find me, and our clinic, Center for Mental Wealth. We're on Facebook at Center for Mental Wealth, Instagram at Center for Mental Wealth. We're on LinkedIn as well, Center for Mental Wealth, TikTok, Center for Mental Wealth,
Okay.
and yes,
In the
and I'm
center
also
for mental health.
Center for Mental Wealth. That's right. And I'm also, you can also find my pages, Bunmi Asana MD, also on Facebook, Instagram, and LinkedIn as well. And YouTube too, Center for Mental Wealth. I almost forgot to mention that. And I would say, in addition to working with individuals, I also work with businesses, and I speak to people, teams and their employees and their leadership teams on employee mental wellness too. So if your company, you notice that your employees are suffering from burnout, or you haven't had any resources to be able to train your employees on mental wellness, you can reach out to us as well. And you can find some of that information at our website, centerformentalwealth.com, and also asanamd.com.
Thank you so much, Doc. This was really,
Yeah.
really good. and we put you on over there, the Center for Mental. I thought it was mental wellness. It's mental wealth.
Mental wealth, mental
The
wealth. Right.
name.
We are investing and building our mental wealth. Just like we build our financial wealth, we got to invest in our mental wealth as well. It's the most valuable asset that we
I
have.
love it. I love
So
it.
that is our passion over here, is helping people invest in their mental wealth.
Thank you so much for doing this, Doc. I
Yes.
will have you
Thank
on
you so
again.
much for having
I will
me.
definitely have you on again. This has been very rich.
Absolutely.
I didn't get to ask all the questions just because time and also how the conversation kind of veered, or not veered but stirred. So we're good. But I look forward to having you on maybe in a couple of months so we could do this again.
Absolutely. Thank you so much for having me. I appreciate what you do, and, putting the education and the content out there, and, just bringing various people with different expertise to educate. It's so important. There's a lot of noise out there. There's a lot of misinformation. So we need people giving facts and correct information to people. So thank you very much for what you do. And thank you for having me. It's been an absolute pleasure.
My pleasure. My pleasure. And to our viewers, thank you for watching live and in replay. As always,
Thank
share,
you.
share, share, because sharing is caring. And as always, if you or anyone you know is looking for an awesome, thorough, and caring family physician in the Mansfield, Texas area, I am she. Oh, by the way, like, subscribe, follow all other things so that way you get alerted when we have or when we go live. All right. Thank you all for watching. Have a good one. Thanks again, Doc. You
Thank
rock.
you.
You rock.